Welcome to Armchair Expert, Experts on Expert. In this edition, Monica,
Dax,
we have a very interesting human being, Dr. Eric Topol, who is going to blow your mind about technology and where we're going with medicine.
it's incredible. We talked about it all weekend.
Monica and I are so excited to get all these instruments he talked about because we want to give ourselves body scans all the time.
Yeah.
Because we're little mini hypochondriacs.
Yeah.
He has a new book out called Deep Medicine, How Artificial Intelligence Can Make Healthcare Human Again. I loved talking to him. And side note, his cute daughter was here.
Yeah, it was so sweet.
Oh, she brought us mugs. We'll get into that in the fact check. But until then, buckle up and enjoy the good Dr. Topol to learn more about AI in your healthcare.
He's an armchair expert. He's an armchair expert. He's an armchair expert.
Dr. Eric Topol, welcome to Armchair Expert. I just want to be really clear. Is it Topol or Topol?
Oh, it's Topol.
It's Topol.
Right.
Good job.
It's rare that I do it right.
It is.
I'm a dyslexic left-hander, and I butcher most names. But you are, if this will be maybe my longest introduction of a guest, which is exciting. You are a cardiologist, a geneticist, a digital medicine researcher. You started and founded Scripps, yes? You're the founder and the chairman, do we say?
Director.
The director, okay, that's great. So I had the pleasure of listening to both a TED Talk of yours and then some panel you were on at Stanford discussing our future in medicine, and I immediately was interested in what a terrible job we're currently doing. Can you walk us through just how abysmal it is right now?
Yeah.
And by the way, can I just also add, I do a lot of work with prostate cancer awareness. So I was a little shocked when I saw some of these, the screenings aren't as effective as I would have hoped as a spokesperson. So I'm sorry, please tell us.
You're right on about this. So the first thing is, what I call shallow medicine. We need to fess up about how bad things are.
Mm-hmm.
We make more than 12 million serious diagnostic errors a year in the U.S. alone.
12 million.
Right. And if you're one of those 12 million people, that doesn't feel good that you have an error, either missed diagnosis or a mistaken diagnosis.
Right.
Then you have, like for radiologists, when they look at films, they have a false negative 30% plus rate of missing important things.
Oof. Do we know, is that the quality of the imaging, or is that like people who watch security cameras for so long, it becomes white noise? Like what's happening there, do you think?
Yeah, no, I think it's partly the latter. That is, each radiologist reading like 100 studies a day.
Yeah.
And it's hard to stay focused. And even human eyes are only so good. And that's what we're going to talk about, of course, of machine eyes.
Yeah.
They're trained. But everywhere you look at it, we have problems. We have very limited time with patients, so the diagnosis doesn't come to mind.
Yes.
And if it doesn't come to a doctor's mind within 5 minutes, then there's at least a 70% error rate.
Oof. And it's gotten increasingly short, the time you spend with the doctor, as the added computer work, basically, right? I feel like I've observed anecdotally in my life going to doctors is I used to go as a kid and the guy looked at me for about 20 minutes and we chatted. And now the guy looks at me like for 4 seconds and is typing the whole time.
Yes, so you don't even have eye contact. The time is so limited. The squeeze on doctors and nurses, clinicians in general has been profound, and it's really detracted, and it's set up for a lot of these mistakes and problems. This shallow medicine, the lack of being able to get your arms around the data for the person, the lack of the real contact to understand the human story of the person. And so whatever way you look at it, so our screening is so incredibly dumb. We have the mammography for all women every year or two, whatever. And
I like to give them to Monica every 30 days. Sorry, I sexually harass I'm just teasing.
So, and 88% of women will never in their lives have breast cancer. And the false positive rate for these scans, whether it's mammography or PSAs, exceeds 60%.
Okay, right. So I want to make this crystal clear, because as I heard you say it on the panel, I want to say there was a study that followed 10,000 women for 10 years. And of those 10,000 women, there were 6% had detected breast cancer from those mammograms. and yet the error rate was, what was it?
6,000 of the 10,000 women.
What? Ugh.
And out of those, so many had unnecessary biopsy, chemo, it could be radiation, it could be surgery, but at the very least, profound anxiety while they were getting further evaluations.
Yeah.
So, this is the state of the art today, and it's really very shaky.
Yeah.
It's just error-laden. There's not enough time with patients, and we really have a broken system because we keep having more people come into the system, and our outcomes in the U.S. are among the worst of anywhere in the developed world.
Right. And so, again, just to kind of dig in a little bit on the mammogram thing, what would we attribute, again, is that user error? Is that poor instruments? Is it bad imaging? Is it a combination of all these things?
Well, it is a combination, but the biggest thing goes back to this Reverend Bayes theorem, which is you don't put people into a test, a screen, unless they have a risk that's increased. So we are violating this Bayes theorem, which is the same theorem of how to pick a horse in a horse race by their prior performance. And so this is that whole Bayesian logic and model. So you don't take every man to have a PSA or every woman to have a mammogram or all these other things we do for people, to people, when you don't have an established increased risk. And so we can be much smarter today. There's so many things that we can do to gauge risk and not treat every person the same.
Right. So in your specialty being cardiology, right, I think as it was explained to me by my cardiologist, there's maybe 5 really pertinent factors in your potential to have a heart attack or this kind of issue, right? There's your genetics, there's your kind of lifestyle, your diet. Walk me through. Is it 5? Smoking,
diabetes, high blood pressure, obesity, and a sedentary lifestyle,
right?
And family history, as you alluded to. But those were the old traditional risk factors that were established, 70 years ago.
Yes.
Over time. But now we can get a genetic risk score for heart disease that's so much more precise and adds to those traditional risk factors.
Oh, so Monica and I both had 23andMe, which we found really fascinating for
Conversation.
Yes.
Just to talk about.
Once I found out I didn't have BRCA, then it just became about whether I have dry or wet earwax and all these other fun things that we like to talk about. Misophonia that they actually have a marker for, which blows my mind.
Yeah, so we could take your 23andMe. We have an app that we developed at Scripps Research called My Gene Rank, which you could download on your phone, upload your 23andMe, and it will give you, out of a score of 100, what's your heart disease risk.
Oh my gosh.
And that is added, that's completely independent and actually as much or more meaningful than any of the traditional risk factors.
Right. Oh, wow, that's fascinating. So I guess I didn't even realize, so when we do 23andMe, do we own our data?
Yes.
We do?
Yes, and you can upload it any time. So as long as you remember your password or get your password again. It was very instructive for me when I did it.
Okay, what did you find out?
Well, I have no family history of heart disease. I got a lot of other bad baggage of diseases, but not
Well, you're too
heart
tall,
disease.
I can tell you that right now just by looking at you.
You're just jealous.
But when I did it, when we developed the app, Ali Torkamani on our group did that. And without the family history, I figured, well, I'm going to be pretty low. And I got a 92.
No.
And I said, oh, man. So recently I said, this can't be. And we updated it to put in all the genome letters that are associated to even better risk score than it used to be. And I was 91. So it didn't
really?
help.
Wow.
So I have a really high risk, and it changed my whole story about what I do because it's actionable. And now I take a statin every day.
Yeah.
But I wouldn't if I had a low risk score because the statins really don't help people unless they already have heart disease for people who are at very low risk.
Right. So let's get really quick into kind of a global part of your story, which is, and we had this great guy, Todd Rose. I don't know if you ever heard of him. He teaches at Harvard, and he wrote a book about the fallacy of the average person and how dangerous it is in many applications, in a cockpit, in a classroom, this notion that we can design a curriculum, we can design medicine based on the average person. And by doing that, you exclude way more people than you actually incorporate, right? So 99.9% of people are falling either above or below this mythical average, and yet our whole medical system is based on this same concept, is it not?
Well, I think most people forget that half of doctors are below average.
Okay.
I think that's a problem.
Wait, you're human too? I don't want to think that.
Well, most doctors don't want to accept that, but unfortunately, as is with everything else, that's the way it works. But, there are ways we're going to talk about that we can upgrade from that.
Right. So, you have a personal story, which again, it's always, I guess, amusing is not the right word, but I'm going to use it anyways. It's amusing to me when doctors themselves are perplexed by their own health or in the dark of their own health. I presume if anyone's going to be on top of it, it's you. But you had gotten a diagnosis when you were younger called OCD, but not obsessive compulsive disorder, although you may also have that. But what is your unique OCD?
Yeah, so I had a rare congenital disease called osteochondritis dissecans, which is a bone disease that was in my knees. It led to, just in between college and med school, I had to have a lot of bone sawed off that was basically dead bone, had a lot of reconstructive surgery. And at that age, which I wasn't even 20 at the time, they said that by the time I'm 40, I'm going to have a knee replacement. Mm-hmm. And fortunately, I was able to eke out a couple more decades, but then ultimately I succumbed, at least for one knee, to have a knee replacement.
So this bone disease, it's just degenerative. It dies on its own.
Yeah,
like on the distal end, or is it in the middle, or where does it?
Oh, right in the distal. So right at the tip of the femur, where right in the joint. And
on the condyles?
Yes, on the epicondyles and the condyles. I didn't know you know so much about the anatomy. That's good.
Oh, thank you so much. No one is impressed. You're the first person who cares.
Yeah, so basically it's an unknown, it's a mysterious disease, and just like so many other rare diseases, it gets no attention. Mm-hmm. So it's just out there.
Yeah, there's
dangling.
a threshold of how many people it needs to affect, right, before it's financially viable to dump a bunch of research and that, right?
Yeah.
I have psoriatic arthritis, which up until maybe 5 years ago was kind of in that. Now it seems very popular. I like to think I'm part of that. But it seems like more and more options are available. But, if you have one of these conditions that you're maybe one of only 100,000 people, you're in rough shape, right?
Yeah.
So you got a knee replacement as a result of this, and it was very, very painful, and you were told that you would be up and running after 4 to 6 weeks or something, and then they prescribed you some physical therapy, some in the house and then some out of the house, and it was excruciating, right? It was making everything worse. And what did you discover?
I tried hot laser, cold laser. I tried every curcumin, every supplement. I did things that I knew there could not possibly be any science to back it up.
Right.
But I was in such bad pain. My knee was purple and grossly swollen, and it didn't really matter as far as if it had a chance to possibly help me. TENS, electrical stimulation. I tried Chinese TENS. Whatever I could get my hands on.
Yeah.
But nothing helped. And when I went to see the orthopedist who did the surgery.
Who's a great orthopedic surgeon, right? You've
Great.
referred many people to him.
Yeah, I had total confidence in him. And there was nothing wrong with the surgery. It was my very severe response to this joint that was put in, which could have been predicted from this rare congenital disease I had.
OCD.
OCD, right. Anyway, so when I went to see him, my wife was with me, and, he said, well, all this pain you're having and your crying spells and you can't sleep and everything, you really got to talk to your internist and get some depression medications.
Sure.
And I'm thinking, what? He doesn't hear me. This is so robotic.
But I wonder if you have the same experience I had, where in the past I had a block of empathy when people with chronic pain would describe being suicidal, and I would think that's absurd. Suicidal, but if you're on that path long enough, and all your waking hours are pretty painful, to me it starts to become pretty clear. You're just getting more and more demoralized, and you recognize at some point, if this continues down the same path, I don't want to do this.
Right. No, I think that, it kind of bifurcates. On the one hand, you could become an opiate addict because the pain is so bad, and the other hand, you say, I've had enough. I want to just kill myself.
Right.
I mean, it's such you can understand why we have this horrendous epidemic today, because once you start on these pain medicines and you're really in pain, it's very hard to get out of, and we don't have the empathy. We don't have the time with doctors and clinicians that we really need to help deal with this stuff. And so, go get some more medications that have nothing to do with the problem.
Yes.
So, this was, for me, this was a really instructive, looking back. Not going through it was total torture, but I did learn a lot.
And you found someone who eventually helped you tremendously, right?
Yeah, it was amazing. I didn't even want to go to her because I had already had physical therapy, AKA physical torture. I didn't want to go near it again.
Yeah.
And I was recommended to go see this woman who was like the guru of physical therapy, and she would know what to do. And I said, sure, right.
Uh-huh.
And she really did know what to do. She said, you had this OCD and you really need a whole different type of therapy. You need to be on high doses of anti-inflammatories, ibuprofen.
Sure.
And,
I like Aleve personally.
Yeah. It could have been either. but-
NSAIDs, is that what they're called?
NSAIDs, exactly. And so she had me on a whole different plan, very gentle, and I started to get better. And it was a really dramatic difference of what I had been going through for many weeks, actually a few months by the time I saw her. The other thing, Dax, is what she did was she showed that she cared for me.
Yeah.
And she would text me every day, how is our knee?
Right.
I never heard once from the orthopedist.
How's our knee?
Once. Like, how are you?
Right.
Yeah. But so it was a combination that she knew what she's doing, but she actually cared for me.
Yeah.
And it was also at a time when I'm researching about AI, and I'm thinking, what is care in healthcare? Where is the care?
Yeah.
And I'm finding it,
It's funny you'd say that because with the psoriatic arthritis, it started in my feet and it migrated north. I don't understand that, but that's the route it's taking. So it was all in my feet. So I was seeing a podiatrist. I got, shoe implants. Then when it got to my knees, I went and saw an orthopedist. I thought, well, I'm going to have surgery on these knees. I'm going through all this for several years, and I have a dermatologist who I just occasionally will tell him like what I'm going through with the feet and the knees and everything. And now it's moving to the hips. And he says to me, I think you have psoriatic arthritis. I think you need to go see a rheumatologist. I don't think that you have these joint pains. I don't think they're injury related, let's say. It was him who got me to go see a rheumatologist. So that just happens to be because my dermatologist likes me and I like him, and we talk about other things while I'm in there. And we have that time together where he's listening. So I don't think anyone's necessarily to blame, but we're going to a really, really interesting place, and that's what you're at the forefront of. So the global problem is really, it's an attention bandwidth problem from the physicians, right? And it's there's the bureaucracy involved. There's the limits of the diagnostic tools. There's all these things, but all of that is changing. It's about to change, and you're really a captain of that ship. So tell us what's coming for us. What's going to change? Right. Because the problem is we've diagnosed is there's really no individual care happening in our system. And we're paying what? It's $3 trillion a year, is that what?
3.6 trillion, 11,000 per person. So the exciting part is both for doctors, nurses, clinicians, as well as for patients. There's this whole artificial intelligence world that is starting now. On the patient side, that was kind of ushered in with a smartwatch that could diagnose your heart rhythm and tell you that it's off track, a deep learning algorithm for you, and say, you know what, this heart rate doesn't fit for you. Your resting heart rate should be this. Your activity heart rate is that, and something is off track. It'll tell you to do your heart cardiogram on your watch, and then you get the diagnosis by an algorithm that's quite accurate.
Okay. That exists currently?
Yes. So that was first. It was introduced by a startup called AliveCore, and then Apple introduced their version almost a year later.
And is it what kind of biometrics are happening? Is it just monitoring your pulse through your wrist?
Yes. So it monitors your pulse, but it learns for you what would be those rates,
normal parameters,
and say, something's not right. It picks that up, tells you to do the cardiogram, and then that cardiogram read is actually very accurate.
So let's go step by step because it's so fascinating.
Yeah.
How can the watch do a cardiogram?
Oh, well, that's
proprietary information you can't tell me?
No, not at all. It's actually, this is kind of amazing. As being a cardiologist now for, 35 years, I never realized how simple it was. All you need is to have two spots on your skin, which is what you get on the watch, to make a loop, and it gets your heart electrocardiogram. It only gets one lead, and a normal full electrocardiogram is 12 leads, but that's all you need is one lead to diagnose the heart rhythm.
Really?
Yeah, so you get one lead, and that basically is a ticket to get you your heart rhythm diagnosis.
That's going to probably clear up a big percentage of the risk factor, yeah? Just that detection,
Yeah, because basically the most common and important rhythm is atrial fibrillation. It's not common in young people, but certainly in people who, over 50 to 60, there's at least like 5% of people that have this, and it can be associated with a stroke. So you want to know about it if you have it.
Is this what is abbreviated to AFib?
AFib.
So, am I right in that? So your heart is a muscle. It basically gets an electric signal to pump one side or the other. I'm already off base?
No, that's it. There's 4 chambers.
4 chambers.
And 2 of them are atria, and they can go into this purposeless motion, fibrillatory. Okay. And it's just quivering. They're just quivering instead of contracting.
HQ, Monica, heart quiver. And 2 of the chambers are pumping blood in, and 2 are pumping out.
Yes.
And then, so if the one's quivering, it could be pumping too much blood in, and then it's not being.
No, basically it's stagnating.
Oh, it is.
So that can form a clot in there.
Okay.
And then that clot can get into the real pumping chamber and get popped out to the brain or anywhere in the body.
Yeah. So now, when you have heart palpitations, is that AFib?
No,
that's not.
Typically palpitations are just some extra beats.
Okay. Because I occasionally get those.
Everybody
gets
those.
My heart's about to blow through my ribcage.
We're hypochondriacs.
That's the worrisome part of having this deep learning AI on your wrist, because people like you are not going to have atrial fibrillation. It'd be really rare.
Right. But we'll be disappointed.
You're just going to have extra beats like everybody else has.
Sure.
So you may get false alarms, say, "Oh my gosh, I'm never going to wear this watch again," or turn this app off, or whatever.
Right.
But the reason I bring it up is it's the first FDA approved deep learning algorithm for consumers. And there's going to be lots of them. And so basically people are going to be generating their own medical grade data with algorithms. And so they're going to get empowered at a level that we've never seen before.
So I think it's important now to also talk about another building block of all this, which is you're using the expression deep learning. And I guess the analogy I would make to this is the CIA has been gathering so much information, right? And the Department of Homeland Security, they have been on a data finding mission. It didn't occur to anyone who's going to analyze all this. So they just have mountains and mountains and mountains of data that no one's analyzing. There's really no outcome to it. It's just gathering without any kind of analysis. And so similarly, right, we have a ton of medical data, but we don't have any. Who's synthesizing it? Who's doing all that? And that's your expression, yes, deep learning.
Well, deep learning is a form of artificial intelligence.
Okay.
So it's really popped up in the last decade, and in fact, just in recent weeks, the pioneers from University of Toronto, Geoffrey Hinton and his colleagues, they got awarded the Turing Prize, which is like the Nobel Prize for computer science. So it's a big deal.
I hope they gave it to him on a Stanley Cup, being from Toronto. I think they'd prefer that.
Yeah, well, Canada has been actually a real big part of this whole AI movement. They've been the hub for deep learning. And so a lot of the people like Jan LeCun and colleagues, they worked with Hinton, and then now they moved to companies like Facebook and all the other tech companies you can imagine. So the deep learning, what that means is that all these inputs of data, so let's say it's an image, like a medical scan or a picture, whatever.
Mm-hmm. Yeah, an example you gave, I think, which was fascinating, was skin lesions.
Yes.
So there was a test, and there was 31 or something dermatologists, or 23, and they were asked to look at a series of different lesions or marks, and then AI was asked to analyze that, and the results were such that AI did it as good as the 21 or 31.
Yeah, it's 21 board certified Stanford dermatologist.
kick-ass A-team dermatologist, and the AI did as well as them, and in some cases better. Yeah,
For melanoma and skin cancers, yes.
right.
And that's been replicated by now many other groups. In fact, almost 60 other dermatologists. So we know now, that's a great example. If you put pictures of a skin lesion or cancer, an algorithm can do as well or better than even experts.
That is incredible. So, in as I see that through, I constantly am saying to my wife, "Hun, come in here. Does this thing on my back look like it's growing?" By the way, who can keep track of what's growing? She does her best, but I don't know. I guess it was a millimeter last time. It would be so awesome if she could take a photograph of it, and then an app could tell me if I need to be panicked or not. And you're saying that exists?
Well, it isn't yet
Not on the commercial.
but it's heading that way.
Okay.
There will be eventually multiple of these apps for algorithms, just like we were saying for heart rhythm, but for skin lesions and for so many other things.
Now, and Monica,
Can't wait for this.
I was just going to say,
Oh my
I
God.
actually think this is helpful for a
Hypochondriac.
hypochondriac because Monica, since I've known her and we're best friends, she has had a brain aneurysm. She's had,
I've had a lot of tumors. I thought I had one this week.
this week I had to talk her off the ledge.
no.
Yeah, she had a
Still
tumor.
kind of think I might.
Yeah,
if I'm being honest.
her liver was going to explode a few days ago. No, her kidneys were going to explode a few days ago.
Well, yeah. But the real stuff is happening to
Yes.
cause these fears.
She's had many, many terminal diseases since I've known her, and yet here she sits shining like a bright star.
Awfully
Doesn't
healthy
she look
today,
healthy?
really.
I'd kill
She
for
looks
her
like
health.
a picture of health.
She does.
I don't need an algorithm for that.
No. So I actually think, I could see where your mind would go like, oh, well, this is going to be a bad thing for people with hypochondria. But actually, eventually you'll just run out of shit to look at. I mean, you could scan your whole body.
Well, like a really good example is a urinary tract infection.
Yes, she's had many of those, right?
So,
Well,
it's-
no, I've never had one.
I mean, you
No,
haven't had one, but
I
you
thought
thought,
I
yes.
thought you had one.
Yes,
so,
yes.
so now, not in the U.S., but in the U.K., they have a kit where you basically they machine learn from a dipstick. Then you take a picture of that on your phone, and you get the diagnosis very accurately, whether you have a UTI or not. And so you won't need to go to a doctor to find out if you have a UTI, because now there's going to be AI to do that for you. This is just so many examples that over the next few years you'll be seeing that are going to help to reduce the need to see a doctor, because these are not serious diagnoses. They're important, but they're not like life-threatening type things.
Well,
They're routine.
melanoma certainly could be. Or,
Well, that's true. The point being is that screening.
oh, okay, okay.
Once you have a melanoma, then it's important to get to a doctor to deal with it.
Right.
But so the point being is that we can get accurate screening, like ear infections of children, all sorts of things that are common, without having to. That'll decompress what doctors have to do. That's one big piece of this. The other thing is this way to make what doctors do, outsource it. Outsource it to these machine work that are trained, like what we were talking about for scans, for radiologists, for slides, for pathologists. I mean, across the board. So, like, if you go for a colonoscopy, you're probably too young to ever have
No,
one
I've
of
had a
those.
bunch of them, and I need to go again.
Oh, that's not a fun
My
thing,
friend
but-
Eric keeps sending me emails with like top-rated, proctologists.
Right. Well, the problem with colonoscopies is that small polyps are very frequently missed. And you don't want to go through that procedure and miss things, especially since those small ones can be just as dangerous as the big ones.
So what would they output the digital video that the camera took to an AI? And
Exactly.
oh, wow.
And the small ones are no longer need to be missed.
No, and it can. I imagine it would do it real time, right? Because often they're cutting them out as they detect them.
Real time machine vision, deep learning of the video.
Oh my goodness!
And is this going to just eradicate internists?
No, not at all. In
Or
fact,
are they afraid of that?
Well, here you're bringing up the kind of thing I worry about the most,
Okay.
Monica. If we take all this efficiency
Yeah.
and we turn it back to patients and restore the patient-doctor relationship, the gift of time, which is what this
Yeah.
can bring back.
Right.
We can actually take medicine back to the way it used to be decades ago when it was a precious, intimate relationship where it was trust and presence and real care. But if we let the administrators do what they would normally do, which is just squeeze more.
Yes.
Then, like you'll say, then this thing will be a horrible bust. It could actually get worse because, right now we have peak burnout, depression, even suicides.
Now, can I ask a global question about this reduced time with the doctor? So it sounds like ideally, Monica, it would get rid of 50% of the low-level stuff that are wasting a doctor's time. Your fake UTI, my fake ear
Which
infection.
is probably a lot of it, right?
Yes.
I'm sure it's
Yeah.
high.
Yeah.
And then give them the same amount of time to focus on some higher level stuff. Now, my question to you is,
But I guess but that's what I mean. Is that going to take away a lot of what a general practitioner does? A more specialized doctor, I don't ever see that going away, but it's just like UTIs and ear infections and colds and stuff like that. If something else can detect it, that's normally why you go see your general practitioner.
well, but they are also, am I wrong? They're the gateway to everything.
Exactly.
Yeah,
So
that's
my
true.
lymph node looks, or I don't know, it's a lymph node, but I seem to have swallowed a golf ball. That was my dad's thing. Like, why is my neck, and he goes to him and that's not great. So then he
Refers.
refers.
Yeah,
And
that's true.
Stay tuned for more Armchair Expert, if you dare.
So back to why we're even in this situation. Is it a result of the population explosion? Has there been a reduction in the amount of doctors? Is it just that more people now see the doctor? Why? What caused this to begin with?
Well, the biggest thing was that medicine became such a big business. And so over the time, there was the squeeze to see more patients more quickly. At the same time, each person was accumulating more and more data. And in fact, that's one of our problems is we, as doctors, can't get our arms around all this data for each person. You can't even get the data in one place, no less, review it all so you
Yes.
can do a good job in trying to sort things out. So at the same time, when this big business was occurring and we had this whole, since the 90s, electronic medical records like Epic and Cerner, all these other companies, on top of all the other movements like relative value units and health maintenance organizations, all these things about the business of medicine, they were done to make money, not to help the patient or
To
the
get more
patient-doctor
efficient.
relation. No, and actually what it's done is, that's what you mentioned earlier, Dax, is when you go see a doctor, might not even make eye contact.
Yes.
Because they're on a keyboard, which we can liberate that because of taking voice to make notes. But basically what we have now is the outgrowth of decades of progressively deteriorating because medicine became such an enormous business. It's the number one employer of all jobs in the United States now.
Is
The
medicine.
number one. It raised over retail back in 2017. So we just keep putting more and more people into this. It's quickly getting to 1 out of 5 every dollar towards healthcare in this country, which is there isn't even another place in the world that's close to 18+% GDP.
To your point, so I just want to point out what you just said, like with a real example, which is I had an allergy to a bee sting at 8. My whole face swelled up. I had 7 asthma attacks over the course of these whatever years. I had blank, 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 blank. When I go see my rheumatologist, all I can kind of tell him about is when my joint swelled up last, right? Or if I've had a surgery 9 years ago. There's no way he's going to spend the next week and a half going through everything that, it doesn't exist, to your point. It's not centralized. There's no record of every stop I've ever made at the doctor. But were there a record, there might be something glaringly obvious that is tying all this shit together, right?
Exactly. You got it.
And AI has the ability to do that in a nanosecond.
Right. And so, just going back to that point as well as Monica's, there's no time currently to think. You've got an average of 7 minutes.
Yeah.
And no less to get this data to synthesize it. And that's what AI can do really well. In fact, we as humans have early satiety with data, and algorithms like what we're talking about, deep learning, has insatiable hunger just can't get enough data.
Yeah, the
And
more it has, the
process-
better it works, right?
Exactly. So
The more we have, the worse we work, right?
we just
Yeah.
lose it.
Yeah, I stopped
So-
taking on new data about 5 years ago when I had kids, I think.
Right. So this is why we need this, and we need to embrace it. And I think that your point regarding our biggest problem today is, particularly in the U.S., is the data are so fragmented, and no one can get all their data.
Right.
Yeah.
So what's the immediate solution for that? So I have a 4-year-old and a 6-year-old, and when I hear you talk, I think, wow, they have a real shot at being at the forefront of this. What do I need to be
Right.
doing? How do I, is there an app? Is there some kind of anything that I could be already compiling every trip that they have to the doctor so that they have a sense of what's really going on?
Yeah.
What kind of patterns emerge? Or
We're just starting to see those sorts of apps develop. But I mean, I think you're right. Your kids are ideal because if they have every medical encounter, anything related to their health from even when they were in the womb to no less to the current moment.
sure, what
that's the
weight
way
they're
to be.
born at, that kind of stuff can be very telling, right?
Exactly. It's big. And we don't even take that into account. So, what we want is to have all the data in one secure place. And it's a much safer thing to keep it in units of a family or an individual than to have it in these massive servers that get hacked and held hostage and data that are sold and brokered and all sorts of cyber thievery that's going on.
Yeah, so do you foresee a day where I will go to the pediatrician, I'll take my kids, they'll do all their stuff, they'll enter it in the computer, and then I will just tap my phone on something and that'll get transferred to some kind of data bank I now hold on to?
No question about that.
That's where it's going.
And you should own it.
Yes.
The reason why it's so important in the era of AI is all about the inputs. If you're missing a lot of your inputs, whatever you get at the other end on the output side is going to be compromised.
Yeah.
So it's essential that we move. And there already are places in the world that have done this. Like example, in Estonia, of all places, everyone owns all their medical data, whatever they're generating, their genome if they have it, all their data from the time of birth on a blockchain platform. So it's secure. They own it. And if you see a particular doctor, like let's say you're going to your rheumatologist, you just share the relevant parts of that.
Right, not my STD history.
Right. But if you want to be in medical research, you share whatever is relevant to that. So the point is you make the call rather than having all your data going all these places that you don't even know.
I don't even love it, by the way, when I call and I want to make an appointment and they say, what's it about? I've had moments where I'm like, like you call to make an appointment with your doctor.
Yeah.
And they go, what's it regarding? And I sometimes want to be like, don't you worry about that person on the phone. Let me and the doctor talk about what I need to see him about. You know what I'm saying?
Yeah. I mean,
Like,
it's
let's just
weird
say-
for you because you're so honest and open.
All right, so wait, let's just role play, though. You're the
Okay.
person. Or bring.
Hi, medical center.
Hi, I want to make an appointment with Dr. Waxler.
Oh, great. We have one at 10 a.m.
Okay, great.
tomorrow.
Yeah.
What is this in reference
Oh, I went to make love to my wife last night and I couldn't become erect.
Okay. How long did you try to
And that's none of your
make
fucking
love?
business. Please get me in with the doctor. What was she wearing? Did you suggest she
Send
wears?
me a picture of her.
You know what I'm saying? Like, no one wants to say that, and certainly many men are making appointments for that exact thing. What do they lie? My hip hurts. Just get me in the room with him or her, whatever it is. Can I raise two things that annoy me about our system? One of the things that annoys me is we have some really emotional attachments to some concepts in this country. And often I find that in practice, it's not great. One of them being our privacy, which in general, I agree with. We should have privacy. No one should be able to enter our house without a warrant, all that stuff. But I'm very frustrated that we had a stupid fucking debate about whether vaccines are causing autism in this country for 4 years. And then they just go over to Denmark or Sweden or wherever the hell it was, and they do an epidemiological study in 5 seconds because they have the data of every citizen.
Right.
And they go conclusively in a minute, no, there's no correlation. I think it's preposterous we don't do that in a country with 300 million people where we could really be answering some huge questions. So is there anything on the table to basically allow our info to enter a pool without any kind of identity attached to it. It's just info. I'm a 6'2" male who's 44. Doesn't need to say Dax Shepard. But why can't we have a pool of data like that so we can do these huge studies in 5 seconds?
Well, I'm with you. That's what we want to have. And right now, the U.S. is really lagged behind. There are countries in Scandinavia.
Well, guess what? China's going to do it.
China is doing it.
Yeah.
So we are behind. We are just. What happened here is that the government caved to these health informatic companies, and they just are like the Tower of Babel.
Yeah.
They don't talk to each other, and we never had any teeth here to say we got to do this together. You know, we have 330 million people, and we can learn from each other and do so much better than we just never have had this type of uniform front.
Well, and that was going to be part 2 of my other irritation with our system. Again, for the record, I am a capitalist. I believe that capitalism and decentralized marketplace is the best system for a country. With that said, I'm not shocked that the folks in Toronto just did this. Of course the folks in Toronto did it because no one's profiting from healthcare there. The government, it's just a big burden that they want to, make as cheap and affordable and as effective as possible. They're hugely incentivized to do that. Our system is hugely disincentivized for you to allow me to stop going to the doctor for 60% of the stuff I need to or get diagnosed by my phone, right? You're talking about this 3.7 trillion is going to people's bank accounts, and they're so incentivized to prevent this from happening.
And so entrenched and so difficult to break up this cartel or whatever you want to call it.
Yeah.
It's amazing. I spent the last year and a half commissioned by the UK to review the National Health Service and to plan the next 20 years there. And it's so different because in the UK, which is amazing, just the opposite of what you were just relating, the NHS is viewed above the royal family or the BBC as the most revered institution in the country.
Yes.
And everyone is egalitarian. The data are shared the way they should be. It isn't perfect by any means.
Sure.
But what the will to change, the will to adopt the AI and these things that we're talking about to make things more efficient, I mean, they're on it. They were the first country in the world to have this whole planning exercise.
Yeah, it's just the apex of stubbornness, in my opinion, to actually be able to see with our own eyes systems that are working better and then just bullheadedly just refusing to adapt them.
Yes, and what's the sorry part about this is that our outcomes, whether you look at life expectancy, I don't know if you knew this, but the last 3 years, the U.S. is declining. It's the only place ever in the world this has happened, whereas every other country, including China, but every other country, their life expectancy is increasing.
Okay, I just want to be a cynic about that number because it's getting touted a lot lately. I did just have this cynical thought. You tell me if I'm wrong about this. It's not dissimilar to ranking California for schools. It's a bit misleading because we have a huge first-generation population, English as a second language. That has a huge impact on our school numbers, right, test numbers. Are we taking on a bunch of folks? By the way, I'm pro-immigration, so it's not a stance on this, but does that reflect just we've taken on a bunch of folks that have lower life expectancies? Is that factored into this number?
Everything's factored in. This is this OECD of all the countries have the same ground rules on how the data is analyzed. I think what we have here is we have horrible inequities. So the people of lower socioeconomic status are really the suffering. But it isn't just the life expectancy. It's every major outcome like maternal mortality, childhood mortality, infant mortality.
Oh, really?
Yeah. So it is.
Oh, yeah, that stuff
it's actually just horrendous. So what has become so problematic with respect to how much resources we put in and outcomes that we should be ashamed of.
Well, you know what I found to be very telling? Have you ever taken a ride around the suburbs of Nashville?
Not recently.
Oh, buddy. Doctor, I did it I wanted to go to some restaurant that was pretty far out of the city. I have never. Now, I'm from an area in Michigan that's pretty close to Bloomfield Hills, which for years and years and years was always number 2 or 3 in the highest earning suburb, in the country.
Yeah, sure.
At best, you can drive for 3 miles and see mansions. I was driving in Nashville for 11 miles looking at 12,000 square foot houses. I couldn't believe what I was seeing. And my friend who lived there, Huey Estes, shout out to Huey, I go, what is all this money? I've never seen this in my life. It's the biggest McMansion. It's incredible. And he goes, oh, it's 100% healthcare. Like 3 of the biggest healthcare are all in that. This is all healthcare.
Oh yeah, HCA is there.
Yeah, and I was like, oh, this is pretty telling. This is a visible indicator of where the money's going, or at least some of the money. Okay, now.
Wait, so are we saying that the reason this new trend is happening is because of this sort of lack of care?
Well, I think it's 2 things, Monica. First is these inequities, the lack of care. The other one is the overcare. So about a third of that 3.6 trillion plus is waste and unnecessary stuff. So the people who can afford care, they get tested.
Right.
You know, they just get so many things done to them. And this is something that we can do better. And a lot of that is, I don't have time to think, so I'm just going to order all these tests. And
Cover my ass, too.
They just get done because I got to see the next patient. So I'm going to have to just order all these tests, click, 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 and you're off to get all these things that you don't need done. So we have a problem both over and under.
I also, who are we just talking to?
Sanjay Gupta.
Yeah,
maybe?
Sanjay Gupta.
Know him well.
And I asked him this. I said, would my own, I lost a dad and a stepdad in the last 5 years. And I just watched the amount of resources and money that last year of their life sucked up. And I thought, I wonder if there's a study of what percentage of your total lifetime care you use in that last year. Is it 10%? Is it 50%? Is it 40%? Just in dollars and in resources. And I thought, again, this is a very dicey question, but do we spend way too much money on people in the last year of life?
Yes, the answer.
And who
is
can
short
bring
answer.
that up? I mean, of course, when it's your loved one, you want it. But I mean, if you're just looking at this huge system, we got to make some realistic decisions. And are we gobbling up way too big of the pie with end of life stuff?
There's no question about that. But I think it goes back again to this time. We don't sit down with families and really explain everything, exude the empathy. And, do you really want to have this person go through this suffering? And, this takes a lot of dwell time with a family to really, so you know their story, the patient's story. And we don't do that. There's no reward for that. It isn't like there's a special RVU code that I spent an hour and a half or 2 hours reviewing the situation.
Right.
It's just only if you care and if you have the time. And we don't have that.
Yet, in fact, Sanjay was saying that part of the thing that they then labeled death panels was exactly that. Just setting aside an hour to tell people, okay, you're 65 or you're 70 or whatever it is. Here are some things that could happen. Here are the outcomes. Here are the statistics. If you use this, this is what it really changes the course. Just the knowledge, because most people just find themselves in a terrible situation where they've gotten a diagnosis that's terminal and they're terrified and their family's terrified. And now they're going to do their thinking and their decision making. They're going to be reacting and not acting. Whereas if you have some awareness of all this and you kind of can enter that with a game plan, you can probably make some better decisions, I would imagine.
Yes, and this is one of those many serious things that where we want to emphasize this human-human bond that has been largely lost over decades. If we bring that back, then this is something that can be addressed. If we use this gift of time right, we can do so much better. And this is a perfect example of where it can be, that time and that bond can be deployed.
Mm-hmm. Okay, great. Now, so I'm trying to think if I left anything out of you're so fascinating. I'm really, this stuff is really exciting, isn't it?
It is.
I just have a really quick kind of technical question. How can a device do imaging? So, I mean,
funny
a
you
mobile
mentioned it.
device.
Yeah,
Okay.
so I use a smartphone ultrasound so that instead of a stethoscope, and here I am, I've been a cardiologist, and maybe I should be disbarred because I haven't used a stethoscope for the last almost 10 years now. Why would I do that when I just pop a probe on my smartphone and I can do high-resolution imaging of any part of the body, especially for me, the heart? And
I want to do my lungs so
I want
bad.
to do
I
my
was a
whole
smoker.
body right
yeah,
now.
I did that, Monica.
You
Yeah,
did?
about 3 years ago, I got this device, and I couldn't believe the resolution. We actually have published it. It's as good as the $350,000 ultrasound machine that sits in the hospitals and clinics. So I decided I'd do a total body medical selfie. And when I was doing it, this is a kind of, I could do the heart easily because I've been doing that for years. But I said, well, how do I do a gallbladder? I had to Google it. And that's how you do a kidney. How do you do a liver? I did all this stuff. I did total body from my, my carotid arteries, sinuses, all the way down to my left foot, everything in minutes.
Really quick, can I ask, what does that device cost?
It cost $199 a month. As many doctors that work together can use it. So it's really not that expensive.
Oh, so it's a subscription-based model.
Yeah. Or you can buy it outright. I think it's some 6,000 or 7,000, but I don't know.
Shit, we
want
could
to do
split that,
Let's do
Monica.
it.
Yeah.
I'll go in on that.
Sell a few of those left-handed mugs and let's buy one. Forget donating it to charity.
Yeah, they are.
Be the
They will be
yeah.
donating it to charity to us.
We'll do nothing but scan our bodies for the rest of our lives. That's all we'll
Could
do.
you scan
But
your
what-
brain with it?
That's the only thing you can is because of the skull. But
right.
what's amazing is, so a few months after I did this, it's funny how it's almost like you had the same reaction. If I had this, I'd do a total body. But a few months later, I started having abdominal pain. I didn't know what it was. So I got the thing. I said, well, I got to find out what this is. And I see I have this dilated left kidney. So I must have kidney stones. So I go to the emergency room and I tell the emergency room doctor, I've got this dilated kidney on my smartphone. You want to see it?
Yeah.
And he thought I was a freaking alien.
Sure.
Okay.
Sure.
And so he didn't believe it. He didn't believe I could image on my phone. So he sends me for a CAT scan. And it was exactly, if I show you the two images, you'd say, which one is the CAT scan and which one is the smartphone?
Really?
Ultrasound. Anyways, that cost like $2,500, that CAT scan. And that's the point is you could get this stuff so cheap through your phone.
No, but were you able to upload your own scan anywhere to have AI look at it? That's not available yet, is it?
They're working on that.
They're working on it.
So there's 5 of these ultrasound probes and apps that you can get today that are FDA cleared. A couple of them are really into AI, so that not only will it teach you how to get the image, so it'll say you got to move it up a little, an inch to the left, and then it also will interpret it automatically for you.
Oh my!
So
goodness.
we're not there yet, but that's what's exciting in the future.
You were able to look at your lungs.
Oh, everything.
That's my obsession.
Oh, well,
I really want to look at my lungs.
I should have brought it with me today. I would have done it for you. Oh man!
I would have loved.
We
What if
would've-
we do a live show? We do a live show with the doctor,
our
and he just scans us.
Yeah, let's do that. I would love
it.
Great.
Should.
But what if we find out I have lung cancer on stage?
Well, at least we'll catch it early or late. I don't know. We don't know where you are in the process.
We certainly don't. On certain days, I feel like I'm late stage.
I do wish we could do brain because that's where I feel like most of my problems
Your business
are.
is.
Yeah.
Well, I'm sure it'll be out, right? It's just
Sometime.
currently there's a.
We don't have an MRI through the phone yet.
Yeah,
but you know,
but if I would have told
One
you,
day.
if I would have told you though, 15 years ago that your phone was going to be able to do what it's currently doing, you would say no way.
you know what also is amazing about this? You would think that every doctor would want to use this because it's so powerful.
Yeah.
And so maybe you'd say, well, some doctors haven't been trained in this stuff. Well, it doesn't take, you could get trained in this in no time.
Right.
But the point is, there's no reimbursement. Oh, okay. And they say, well, it's too expensive. Well, it's really not that expensive. But each test that you do with an ultrasound is between $800 to $1,000.
But again, they love that. They love that.
And no one wants to give that up.
Yes, that's the problem.
Hospitals, if we started doing these left and right, then the hospitals, health systems would say, oh, no, you're cutting into the revenue here.
Yeah. Okay. I want to ask some fun questions now. Based on assuming that this is all going where it obviously is, and I'm really glad that. Just tell me in a nutshell, Scripps Research Institute, and you also got a huge grant from the National Institute of Health, right?
Right.
For $207 million, and it's called the Precision Medical Initiative, and it's going to monitor 1 million people. Is that how it works? And is it going to be using these kinds of devices?
Yeah, that's what we're doing. So this Precision Medicine Initiative, it's an all of us program. It currently 180,000 people, Americans of 1 million, have enrolled. More than half are underrepresented minorities, which
great.
is really important.
Yeah.
And they are going to have all these things. They're going to have genomics. They're going to have sensors, all the sensors we've been talking about, their gut microbiome. I mean, the whole works, because they're going to have like big data per each of them, get back to the data will go to them. And that's going to be hopefully the beginning of a large, diverse population participants who will usher in this new form of medicine over the years ahead.
Can I ask, because I'm very, very interested in microbiome. I weirdly think that my arthritis is a result of not having the right biome. So how is that monitored?
Well, that's a really important question because it's just changed in the last few weeks.
Oh, really?
Yeah, our understanding of it. So it used to be you could just send a stool sample.
Okay.
And you could send to many different companies like, uBiome, American Gut. There's a long list of them. And for, similar to 23andMe type $100 or something, whatever like that, you would get an output. You have this Bacteroides this and this different bacteria, how much percent density. Turns out that's only scratching the surface. What we really want to do is sequence each bacteria because you may have deletions and changes of the genome of that bacteria that are predictors of things like psoriatic arthritis.
Okay.
So it turns out it's much more complicated than a lot of people thought. The microbiome is far more important than anyone had ever estimated.
Well, look at the results. So, as you would know better than anyone, but people get C. diff, right? And C. diff is really hard to treat because they blast it with antibiotics, but then the antibiotics often kill a bunch of great bacteria in your stomach that could help fight the C. diff. And people are doing these fecal transplants and getting like 90+% results, which is what triple of what any other approach is. And again, it's a product of this fucking health system. Because in Canada you can do it everywhere, and there's clinics here. I think in California you can only do it 3 places, and it has to only be for C. diff. So if you have any other condition, they will not allow it. And it's just I don't know why. I think there's so much in introducing the right gut bacteria to treat a bunch of different issues.
Yeah, so you're bringing up a really important point. So this fecal transplant thing is had shockingly good results, almost 100% curative for the C. difficile, which can be a lethal problem, this so-called pseudomembranous colitis. So a lot of people want to say, okay, well, why can't we do a fecal transplant for other conditions where the gut microbiome has been implicated as causative? And if we just take a healthy person's gut microbiome, we could, come up with a far better way than all the other approaches we have. The problem is this fecal transplant from donors is tricky, and people want to develop these like poop pills or crapsules.
Sure, crapsules.
Oh,
that sounds fun.
Where it's a cleaner way. You know? Because what are you going to do? You're going to have like donors, healthy donors that keep sending their stool samples and
the whole process. Because I literally considered it because I'm like, oh, fuck it. If I can't go to a clinic, which I would far prefer, I don't want to handle any of this stuff. But if I don't want to be on an immune suppressant for my psoriatic arthritis, I'd much rather do 3 fecal transplants and be done with it. So I'm open to it happening. I think what's really telling is even if you go in for C. diff, they don't want you to take the stool of anyone with mental health issues. They don't want anyone with obesity. And just by knowing that they don't want you to take that person's stool tells me, oh, those people have microbiome problems which are causing that. Or why else would they not want you that introduced to your system?
Because
they won't go so far as to say that. But
right.
Stay tuned for more Armchair Expert, if you dare.
The problem we have here is the lack of cause and effect. So there is all these associations with all these various conditions of gut microbiome associated like with everything now.
Yeah.
And so no one really knows. But when you manipulate the microbiome, whether it's with a fecal transplant or ultimately with a poop pill thing, then we'll start to learn. It wouldn't be at all surprising to me that certain autoimmune conditions are markedly ameliorated by manipulating the microbiome. I wouldn't be at all surprised based on everything we know because the gut microbiome is so critical to our immune system. In fact, even this week it was reported in Nature, which is the #1 biomedical journal, that the gut has its own compartmentalized lymph node system we never knew about.
Wow.
Because it's basically dealing with this microbiome story.
But it makes so much sense for me to know that the only thing that's ever really helped was being on a specific diet, right? So what it tells me is that my body has an allergy to a lot of things I'm eating, and if I get rid of those things, then the allergy goes away. But what it tells me further is something in my stomach's not processing that stuff, or there's something, there's just a lot coming out of that gut.
We got in a fight about it because he didn't want to take my poop. When we were deciding who was going to give him the transplant, I was not an option.
Well,
Now, why is
I was
that?
upset.
Well, first and foremost, Amy Hansen won the award. It's a friend
Our
of
friend
ours,
Amy,
and basically we all decided we wanted her poop. And for any number of problems that people have, we just decided she's the healthiest, happiest, best person we know.
Yeah, and I was offended.
And we all wanted her poop, and we were just thinking how rich she could
You
become.
were afraid you become a hypochondriac?
Yeah, maybe
It was related to that. Well, Monica had a spell of anxiety, and I'm like, well, I don't know. That kind of falls into the little. I certainly don't want anxiety.
Sure.
I don't think Amy Hansen has any anxiety.
Yeah.
But at any rate, Monica was very hurt that I didn't want her poop. But you were like second on the list. That's just pretty high up
Pretty
there.
good, but I like being first. I like winning.
No one wanted my poop, so let's just and my feelings weren't hurt. Okay. Here's a couple questions I have. Assuming that this really takes off and that your average American on their phone is getting all this information. Okay, so let's say that there's 300 million Americans, they have this tech. Now we potentially have 300 million people that know about ailments, which in theory is great. Everyone should know if they have something. But can our system handle that?
Well, what we want to do is to fulfill the dream of prevention, which we've never been able to do before. I mean, the only ways we had to approach a prevention were like a mass strategy, stop smoking kind of thing.
Right.
But we didn't have prevent the illness that you would otherwise get, which we are quickly moving into that era. Mm-hmm. So like, for example, we talked about the polygenic risk score for heart disease. If you really are at high risk, that you would try to prevent that from ever occurring. And there are actionable things that you could do. Mm-hmm. Whether it's a healthy lifestyle that's specific for you or taking statins. That's just one example. The same would be for diabetes, for asthma, for almost all the common conditions where there is a strategy. Mm-hmm. If you knew you were really at risk.
Right.
So instead of what we have today, which is we basically treat all people the same, we don't really prevent anything.
Yeah.
We are going to move into a time when this is going to, by having the data for each person and having predictive algorithms, having a virtual coach. Mm-hmm. So instead of your phone telling you how to get from here on your GPS, it will be constantly uploading your data if you want. I mean, this is something that's optional. Your whole corpus of the medical literature, everything that's relevant to you, of the massive literature up to the moment, with every layer of your medical data coming into you and coaching you, saying, you are at risk for asthma. This is how we're going to, you'll never wheeze in your life. We're going to do this for you.
Right.
And I mean, in the book, I gave many examples of what it's going to look like. And it's not that far away because this is basically that enormous data set that's constantly seamlessly being processed for you. Mm-hmm. And then also being looked at, in large numbers of people to make that better and better over time.
Mm-hmm. Okay, so great. So you kind of just touched on something. Have you read Yuval Harari's book, either Sapiens or Homo Deus?
I read them both, and I know...
Are you quoted in Homo Deus? It seems like you would be.
I was quoted in Homo Deus, yes.
Okay.
I know him. We hooked up in Israel. We were on the same panel in a program at Haifa. And what was really interesting is his mother was with him.
Okay.
And he was born in that hospital. And he hadn't been back there in decades. So anyway, I got to know him, and he and I have corresponded since. And, he's a really interesting fellow.
Oh, he is. Now, what I said to him, I interviewed him, and I've never had an experience with time like this in my life. I thought we'd been talking for like 11 minutes and an hour and a half had gone by. I mean, he's just... And his unique ability, he is like AI because he has all these interdisciplinary kind of focuses. Yeah. And there doesn't seem to be a scholar that's really synthesizing all these vastly different fields, anthropology and psychology and all this stuff. So he's kind of putting some things together and asking some really poignant questions. So one of them that he brings up in Homo Deus pertains directly to this, which is setting a goal for yourself, right? So What he explains very simply, we think of ourselves, the self, as one thing, the self. But in fact, there are two distinct selves, minimally, one of them being your experiential self. So that's you and I sitting here experiencing this moment. If I'm on Instagram, my experiential self loves it. And 2 hours could go by, and the experiential self enjoys every minute of it. Now, when I go to bed at night, the narrative self evaluates my day. It's writing the story of my life. It's very disappointed I spent 2 hours looking at Instagram, right? So these two things are often diametrically opposed.
Right.
So when you set a goal for yourself on this app, this thing that's going to help you, who is the AI supposed to service only your narrative self, or is it supposed to service your experiential self? Should it have the authority to trick the experiential self to service the narrative self's goals? I mean, these are real. They're very broad philosophical questions, but they're becoming a reality.
Well, they'll be in your settings.
Okay. You just move the thing between experiential and...
Yeah, I'm done with that narrative. I'm going to the experience.
Yeah. But
sure.
it poses really, really interesting questions.
I agree.
Because the example he uses in the book is that you, with all these devices, you could be walking into a meeting and your phone will tell you, don't talk in this meeting. Your blood sugar's low, you slept like shit last night, and your cortisol levels are high. The last time you spoke up in a meeting, you got in trouble with your boss. Right?
Yeah, but he also got carried away.
Oh, good. Tell me.
I debated him about this.
Okay, please.
Because
tell me.
In the Homo Deus, where he's projecting the future, he says, we're not going to need doctors. Algorithms are taking over, and he just doesn't get it because he doesn't have a medical grounding.
Right.
That we are going to need doctors, but they're going to be reconfigured as to what they do. So he gave too much credit, I think, for in the book on IBM Watson Health, which hasn't really done anything yet, and projected much too strongly how the entire medical profession is going to be gutted. He and I really disagree about that. But you touched on it, Dax. When the self-driving car thing got really hot, which still is, but the people were talking about we're going to have totally autonomous cars. And there's these levels where level 5 is no possibility of backup, no human backup, level 5. Well, it turns out we will never get to level 5 because level 5 is affected by weather, road conditions. You need to have a potential for backup. So just as we've now blown through the possibility of total autonomous cars, it'll never happen. People, the top people in this field, which is the pinnacle of AI, all agree we'll get to level 4, but never to absolute no backup under any conditions. It's the same thing in medicine. We're never going to get to a point where all things in healthcare are going to be done without human backup.
Right.
Now, certain things like we talked about. So this, I think what you're getting at is, initially there's exuberance about automation.
Yeah.
Then we kind of reset. Well, wait a minute. There's certain things that just isn't going to work where you can just automate everything under all conditions.
Okay, so great. So in this future world where the device is potentially diagnosing you with things at a rate that's on par or better than other doctors, will the AI be licensed to prescribe medicine?
It can be. In fact, for example, in the UTI thing I gave, the algorithm gives a prescription based on the patient's information about what antibiotic to take.
That goes straight to the pharmacist or has to go through a doctor?
No, right to the pharmacist.
Really?
No doctor. Wow. No doctor. Okay. Now, that might not go over well in the U.S. because, but that's what's happening. And you can see that with children with ear infections. A lot of things where it's, you check for allergies, you know what the common first-line drug would be. Yeah. Why would you have to bother a doctor?
Yeah, exactly.
Right. I guess there will just be categories because I'm 14 years sober. My addict brain goes straight to, this is awesome. I'll have a device. I'll have a friend with a broken bone. I'll fucking scan his bone. I'll get Oxycontin prescribed to me. So that's immediately where my mind went.
Probably not that one.
Okay, so there'll probably be categories of drugs that are abused. It does boggle me sometimes, things I have to get prescriptions for, where I'm like, this can't be abused. It's not life-threatening. No one would take this.
In most countries around the world, those sorts of things are over the counter.
Again, it's all money, I would imagine, right? I know, because I remember being even on a Eurail trip when I was 19 in Europe, and I had, not to get you too excited, but pretty bad diarrhea. And I went into the pharmacist in Paris, And I'm like acting out what I'm going through because I don't speak French. So I'm like squatting and crying and holding my stomach. And yeah, the pharmacist gave me a prescription level anti-diarrhea pill that worked like gangbusters. I was out drinking and eating, French food hours later. And I just thought, this is crazy that you can have that here or there and not here. It's a little bit disheartening. Well, I'm so excited about your work. And I really hope that your project yields great results with the 1 million folks getting monitored and implementing that. And I do see this as a hugely democratizing bit of technology that's going to benefit a lot of people. I just hope people don't get assassinated. This is a lot of money at risk.
There is that, and there is this potential that we can make things so much better than today, but also as we've reviewed, I mean, it's early, but it could go to make things worse. So we have to really plan this. We have to seize this opportunity. We may not ever see anything like this again for generations, if ever, because the potential impact of AI with this torrent of data for each person could really be a great way to take us back, to restore the way healthcare used to be.
Yeah. Well, I wish you a ton of luck. I'm so glad there's folks like you out there that haven't dedicated their lives to off-road racing like me. And you have a book, right? Your book, Deep Medicine. That came out this year, 2019?
Just a month ago, yeah.
A month ago.
Great.
So check out Deep Medicine. This is all very, very fascinating. Thank you so much for coming. I really hope we get to do it again.
Excellent. Thank you.
And now my favorite part of the show, the fact check with my soulmate, Monica Padman. Oh, Monica, I don't have a song, unfortunately, because we have an exciting morning here. There's someone observing us right now.
Ooh.
And we're going to try to not let that affect our honesty and whatnot. But
no, nothing can affect our honesty.
We have a LA Times reporter here to make sure we're crossing our T's and dotting our I's. So
Great.
Eric Topol brought his daughter, Sarah.
Yeah, it was so sweet.
We were very flattered to find out that she was a hardcore armchair, and she brought 2 gifts. One of them,
Incredible gifts.
really thoughtful, well thought out. Monica, what did you get?
Okay, I got a mug that has a picture of my boyfriend, Ben Affleck, on it from Good Will Hunting. She picked the right picture.
Mm-hmm.
And on the back, it says...
Well, it's incorrect, but it doesn't matter because we know what it was supposed to say, and she knows what it's supposed to say.
Oh, it has coffee on it.
Oh, someone snuck into the attic and drank some coffee out of it.
It says, "What about them facts?" But it's supposed to say, "How do you like them facts?"
Yeah, like as a reference to how do you like them apples.
Correct. It's beautiful.
Mine is a picture. It's got a picture of my boyfriend, Brad Pitt.
Sure.
And my boyfriend, Jay-Z.
Uh-huh.
And then it says, "Don't trigger me" on that.
I know.
It was really thoughtful.
All of our boyfriends are represented.
Yeah. Yeah, we both got guys.
we do. I have to correct something from last week, Sanjay Gupta.
Oh, okay, of course.
My father listened. He doesn't listen.
Ashok Padman.
Padman. Yeah. Why'd you say my last name all weird?
I said Ashok Padman.
No, you said it with an accent.
No, I didn't.
A little
Did
bit.
I? Okay.
A little bit. Just because.
Oopsies.
Wow, that's interesting because the first name threw you off.
Yes.
You're used to saying Padman.
Let me just say it was unintentional.
I know.
Yeah. How did I say your mom's name in the car? Myrma.
Yeah.
And you said her name is Nirmala.
Yeah.
And I boggled it. I said Myrma. And then you said maybe that's a cute nickname that I can.
Yeah.
Yeah. Well, let's get her permission first.
Yeah.
But Mamama and Myrma is a fun team.
That's also a mouthful.
Next time you guys are at the shopping center in Georgia, people will go, "Oh, Myrma and Mamama are here."
Yeah.
Wouldn't that be fun?
That'll be cute.
Can I suggest something?
Sure.
You'll wear a shirt that says Myrma with an arrow pointed to your mom, and then your mom will wear one that says Mamama with an arrow pointed
That
towards you.
sounds classy.
But you'll always have to be positioned correctly for it to make sense.
I bet we'll get in a fight about that.
Yes, probably. But Ashok.
My dad, yes, he doesn't listen to the podcast, but
Thank God.
Thank God. Dad, if you're listening, turn it off. You're not allowed to listen. You don't have permission. No, he's probably thrilled to hear you talking about him in such a positive light. Yeah.
Right. And that his
head might be getting a little big.
I hope so. It deserves to be big. I wonder if he's heard that basically there's a job offer on the table for him to do our political, especially as we ramp up for this election. I think we definitely need a Shoke's point of view.
Well, it's not really a point of view. It's just facts.
Yes.
Well, he has. That's not true. He has quite a point of view.
He sure does. It's really fun because, in general, I'm outnumbered.
Yeah.
You disagree with this assessment, but you and Mom are always ganging up on me.
Well,
and when your dad and I are together, we're ganging up on you because your dad and I are pretty lockstep with our political views.
True. But my dad, Dad is so embarrassing. To be honest, and I feel this way about you too, if I'm being truthful. I don't know what he actually believes.
Oh, okay.
Because he is just very good at arguing, and he'll just argue whatever.
For sport.
He'll argue the opposite side of whatever you are saying. And you do the same thing. So I don't really know what you two think about anything.
I'll have it engraved on my headstone.
What you think?
Yes.
Okay, so we'll finally get to know. I might be
it'll say Reagan was my favorite. It'll just be my headstone. You're like, wow, I didn't see that coming.
That will only work out for me if you pass first.
Which is statistically very probable.
Well, we don't know because I had a tumor this week.
Well, thank goodness Dr. Eric Topol was on because it seems that we have a solution to your hypochondria and my
Yeah.
What would you give yours out of 10 and mine out of 10? Because I don't think they're the same.
Well, I know you don't think they're the same, but you wouldn't think they're the same because when you see it in another person, it's highlighted big time.
That's true.
When it's you, it feels more rational.
Right. Totally.
I've seen you do it many times.
So what would you give us?
I would give, what's a 10? Like, who's a 10?
I would suppose 10 is someone who is absolutely arrested by their fear of physical ailments in their living. I mean, I guess they're like in their house wearing aluminum foil over their head and all the doors and windows are sealed.
Right.
Yeah. So that's a 10.
That's a 10. Then I am a 1.
No.
I'm just kidding.
0, just to give the opposite.
Zero's on
0 is your arm is cut off laying on the floor and you don't think anything's wrong. There's no need to go to the hospital.
I'm probably a 7.
Okay, wow, I'm proud of you.
I know. I was going to say 5.
That's what you really feel. But you're like, you know what? I got to counterbalance my own bias.
Yeah.
Yeah.
But 7 feels a little high. I'm not like...
You're right. If 10 is someone with the windows sealed, then yeah.
Like I didn't get a neurological scan this week, even though I thought I had a tumor.
And if you could have done it without a lot of inconvenience, you would have.
Yeah.
Yeah.
Yeah. I would have. I think I'm a 6.5, 7.
Okay.
And you are a 5. You disagree?
I'd like to see like 3 points between us, to be honest. I would like to be a 4.
That's not true.
And I'll even let you go to a 6 as long as I can go down to a 3.
You're not a 3.
Okay. All right. All I can remember thinking is that I had a brain tumor.
Yeah. Same thing I thought.
Yeah, but that you had like 7 other things.
No, you thought you had a brain tumor. You thought something else. I forget, but I notice it when it's happening with you, and I like that it happens to you because I don't feel so alone.
Right. And we both admit it's kind of a failing in some way because we never have these things that we think we have. So
we know of.
We're wrong. Just in general,
Maybe.
We're wrong. Okay.
I don't feel 100% certain that I didn't have rhabdo and that I didn't have...
Thank you for remembering. You thought you had rhabdo. It's so extreme.
I still feel like I could have had it.
I don't.
And then
I really don't
recovered.
think so. No.
My body's really good at recovering from things.
You'd have to be doing
Exercise. I
No,
did.
not.
CrossFit.
Yes, you'd have to be doing CrossFit
I was.
but 7 days a week.
No. It happens in a one instant
one
thing.
shot?
It does. It's
Okay.
an overuse in an instant.
Not a habitual overuse.
No.
Okay, just one and out.
Yeah. So
Well, that's
I could have had it.
That's scary. Like, because if you've never hiked or anything, and then you're like, I'm going to walk up to the observatory,
Yeah.
rhabdo.
Well, you could,
Is that what you're saying?
but no, because that's not extreme. That's not.
If you
intense.
haven't like climbed a flight of stairs in a decade, that would be
Okay.
very extreme.
Then yeah, you probably shouldn't start off hiking Griffith Park if you've never climbed a flight of stairs.
That's right.
So yeah. Should I tell people what happened last week? No.
With what?
To me.
Your ailment?
Yeah.
Oh, God, yes.
Should
Absolutely.
I? It's
Yeah.
so embarrassing.
Oh, I think it's adorable.
Okay. So last week I had a horrible incident
Mm-hmm.
that caused me to feel like I had a brain tumor. And I still might have.
Okay. You wake up in the
I
morning.
would wake up in the middle of the night-ish. And I had felt some wetness
Mm-hmm.
near my underpants area.
Okay, sure.
And then I thought maybe I just had a really intense night sweat. Sometimes I get those.
You didn't at any point think, oh, I started my period in the middle of the night.
No.
Okay.
I'm very regimented on my period.
Right. Okay.
But then when I started doing some investigation, it was urine.
Yawn.
It was pee-pee.
It was yawn.
A good amount of it.
And you're 31.
In my bed as a 31-year-old woman.
Woman.
This has never happened before. This isn't like I have incontinence.
Nor even Sarah Silverman's past
No.
of being a late bedwetter.
Exactly.
Yeah, no history.
I haven't peed in the bed since I was probably 5 years old or earlier than that.
Yeah.
I also don't pee very often at all. So the fact that it's uncontrollable in my sleep,
Was a red
very
flag.
scary.
Yeah.
Yes.
And accompanied with severe back pain.
Severe
Yeah.
lower back pain. So of course I was like, okay, something's wrong with my kidneys. I probably have a kidney infection,
Right.
which I've had before.
Okay.
The next day, I text my friend.
This is the greatest.
I text my friend, Allison Kirksey, shout out.
Yes.
If you need PT in Los Angeles, please go see Allison Kirksey. She's the
but only if you
shit.
really need it. Not just because you want to meet Allison.
Well, if they're going to pay her, I'm sure she's
Well,
fine
that's
with
true.
it.
I guess she could just hang.
Yeah.
She'd
She's a
probably
good
prefer to
hang.
do that. Yeah.
Anywho,
She
she's
fields, I just want to say for the record, she fields a lot of your calls.
poor girl.
Yeah.
Yeah. She gets a lot of texts from me. This is happening. What do you think? And by the way, she's very good. She never makes me feel stupid.
Mm-hmm.
She always listens to what I have to say and then says, okay, yeah, that's a little of this, but it's probably this.
Mm-hmm.
I can tell she's just being really nice and telling me that I'm
Yeah.
overreacting.
Yeah. She's also, again, she's super knowledgeable. Also not
Very.
an internist.
No, but the things that I'm asking her normally are like muscle related.
Skeletal.
Yes.
Okay.
And she can tell based on like symptoms or based on what's happening if it is muscular or she's like, this doesn't.
This is an organ issue.
Yeah. Or
Okay.
this, you need to go see the doctor.
Right.
Which she never says.
Right. Right. She's not yet once said. Go.
Except
Oh.
on Wednesday, I said, okay, this all happened. I'm having really, really bad back pain.
She also has a 1-year-old she's dealing with, right? Like when you call.
Yeah, and she's about to have like she's pregnant. She's gonna deliver any day now. And
Right.
I'm like, I need help.
Yeah. Help.
Because also I was texting her and she was like, at the end I was like, are you doing okay? And she's like, yeah, I'm ready. I'm good. And she was like, do you want me to come to the doctor? And I was like, I mean, no, because you might need to be going to the doctor at any moment.
Right.
Anywho, she said, yeah, this is strange.
Mm-hmm.
And it's definitely not consistent with acute muscle pain.
Great.
So she was like, I do think you should go to the doctor about this.
Mm-hmm.
And she never says it. So then I was like, oh boy, okay, great.
So you went.
So I went, they did a urinalysis. even though I had no pee-pee left.
Okay.
And they...
You should have just brought your sheets, cut off like a corner of it, and then stuck it in that little
my underwear.
plastic. Oh, that's my favorite joke. Should I tell it really quick?
Sure.
An old couple go to the doctor, an old man and a woman, and the man needs to get his physical, and he's kind of hard of hearing. So they sit down, and the doctor says, okay, well, before you leave, I'm going to need a blood sample, a urine sample, and a fecal sample.
Okay.
And the man says to his wife, what did he say? And she goes, she needs your underwear.
That is good. Ew. That's a good joke.
She needs your underwear. Okay, so.
Anyway, so then I went to the doctor. They did urinalysis. There was nothing wrong with my kidneys.
They draw any blood?
No.
Okay.
And they didn't check my brain.
Okay.
And I also had a big abscess on my foot. And
Well, hold on.
no, I did.
You stubbed your top of your foot.
No.
It
I didn't
was-
stub it. I would have remembered stubbing it. It appeared out of nowhere.
It's clearly a scrape. You scraped it on something.
Listen, no. It was very deep
Okay.
So I have a big abscess.
An abscess, yeah.
on my foot, and I had 2 bruises on my head.
Right.
And it's weird.
Yeah. You're not taking Ambien or anything at night.
No.
Okay. So you're not walking around and banging into shit.
That
and just
I know
forgetting
of.
That you know of.
Yeah.
I think you fell out of bed.
Really?
Like a baby, and you hit your head,
And
and
then
then when you got up, you scraped your foot on the bottom of your bed, and then you got back in bed, and you were confused and thought you had made it to the bathroom, and then you just squirted, and then that's everything.
What about the
no
back?
brain tumor.
What about the back pain?
Totally, what are the extraneous information, like on a SAT test? You just throw that right out.
What?
Unrelated, uncorrelated.
Unrelated, middle of the night,
Yep.
throwing out your back.
Yep.
Okay.
Yeah.
All right.
Or maybe sustained during this fall.
Okay.
When you were half asleep.
I
But
think I would
anyways-
have probably woken up by the crashing onto the ground.
Right, but you went straight to brain tumor
Well,
or
yeah.
aneurysm. I would do want to delineate a little difference between your and my hypochondria,
Okay.
which is I have these thoughts and then I just never go to the doctor.
I know, but I was in pain.
Oh yeah.
So
I'm
I
just
had
saying
to.
you're more prone to go investigate, whereas
Yeah.
I whip up some crazy theory, and then 2 weeks later I've just forgotten about it, and I'm feeling
Right.
normal.
I guess that's true. I
Yeah.
mean, if there's physical symptoms that need addressing, yes, I'll go to the doctor. But I didn't go to the neurologist like I wanted
Right.
to.
Okay.
It was rough. And anyway, that led us to have a conversation about wearing adult diapers.
Oh, right. So I'm leaning towards this. So I wake up in the middle of the night to pee, minimally once, always. That's guaranteed. I'm going to sometimes twice a night, and on a bad night, 3 times a night.
Yeah,
and then I
that's
have
a
a
lot.
very hard time falling back asleep. It
Yes.
takes me 15 to 30 minutes each time. So I'm losing an hour and a half on a bad night of sleep. And it's only going to get worse. I have older friends, and for males, it just gets worse and worse and worse. And in this group, we were talking about it. All the males there were experiencing nighttime peeing
Yes.
that were over 35.
Yes.
So my thought was, why don't I just start wearing Depends undergarments and training my body to pee at night, which I do think will take a few weeks. I think I'll wake up in the middle of the night, oh, I got to pee. And I'll go, oh, I've got my diaper on. I'll just pee. And then maybe the next time I wake up, I can do it more half asleep. And then eventually I'll just train myself to pee at night in my diapers, and then I'll get way more sleep. And I was posing the question, why not do that? What's wrong with that?
Right.
You were opposed to it.
Well, for a couple reasons. One, if then you're in a situation where you can't, your mom is calling me.
That's
Should I answer
scary.
it?
Oh, sure.
Hello? This is Monica. Hi, Gaga. Yeah. Did you? Oh, I'm sorry. I got your text and I thought I responded, but I probably did not respond yet.
She's in the middle of a fact check.
We are recording. Yeah, we paused to answer an important call. No, it's okay.
Oh my God.
Thank you. I will tell him that. Okay, bye.
Well, that was a first.
Anyway.
Great. I had a whole flow going about my diaper. And
Well,
now it's
no,
all
it was my
fucked up.
turn to talk. Don't
It
worry.
was so appropriate that I'm talking about returning to diapers, and then my mother would call.
That's
The
right.
last person who dealt with my diapers.
Yeah, she sensed it.
She did. Like, I feel like he's about to try to be a baby again. I gotta
I
put the
gotta
brakes
check
on this.
in.
I put a lot of energy into getting him to not be a baby. Okay, so what's your
Okay, so
objection?
I had a couple. One, what if you're in a situation
Mm-hmm.
where you are in a group setting and you can't pee, but now your body's trained to pee in the middle of the night. So you're definitely peeing the bed and there's going to be a
Well,
stranger there.
hold on.
Camping. Let's say
Oh,
camping.
Okay, so I'm camping, but I'm camping in a tent with strangers?
Yeah.
Why am I doing that?
Apocalypse. I don't know.
Okay.
There's plenty of reasons that I
Okay.
can't really get into, but
Well, I can concede that if there's an apocalypse, this was a bad idea.
okay.
Okay.
Also,
Let's just assume, though, for shits and giggles, that there's not an apocalypse.
what if you just had to share a bed with
I'm now bed hopping? Let's say
what
with
if you
Scarlett
had-
Johansson.
Yeah, you had to.
So yeah, I just tell her, look, I'm older. I pee a lot in the middle of the night. It was cutting into my REM, and now I've got this solution. It's an adult diaper, and I wear it. Big whoop.
Okay, so
But then this led to another conversation.
well, she wouldn't be able to snuggle you.
Why? I'd snuggle someone with a diaper. I snuggle my children.
It's
They
gonna
have
hurt her
diapers.
body. It's gonna hurt her skin. It's
No.
gonna chafe her skin, and she doesn't like it.
They're not made of burlap. These are going to be a nice,
Are they
comfortable.
gonna be Hello Bello diapers?
I might have to just make an adult one. I don't. Why not?
Okay, here's my other fight.
I think this is like a Jonathan Haidt kind of
Moral
moral
backpedaling thing.
a thought experiment about morals. There's no morals about peeing in a diaper as an adult.
There is no morals. I'm talking about practicality. What
Yeah.
if you want to get frisky in the middle of the night? That was my other thing. And you said that
No, thanks.
you're not interested.
Not at all.
And
No, I'm
That's-
44. We're married. There's no way we're getting frisky in
what
the middle
about
of the night.
Scarlett Johansson? This scenario.
I will make an exception. I'll get frisky in the middle of the night,
But
and
you
I'll remove my diaper and I'll do it in a very sexy manner.
No, she doesn't like
Yeah.
that. No.
I'll take it down like do 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 do.
Ew, she's puking.
Do 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 do.
What about the
Diaper.
smell? It smells like pee when you wear a
Well,
diaper.
let me tell you. Okay, so let's get into that. I drink fluid compulsively, as you guys can all attest to. There's 7 drinks on my desk right now. I drink so much fluid that my urine never smells. It smells like water. What does water smell like, Rob? You think you're going to wake up in the middle of the night puking because you smell water? No, you're going to wake up
It also
thirsty.
doesn't smell
thirsty.
that
Scarlett
bad.
Johansson
I
will
can-
be thirsty.
Ew.
Yeah, when she smells that clean water in my adult
She
diaper.
is not going to want to snuggle your wet body
Well,
covered
ask-
in pee.
I hope we interview her and
Me
we
too.
ask, because I got a hunch she can kink out on it.
When you said
So-
that you would like it, right?
Well, right. So that led to another conversation, because this is how it started. God bless Delta. She's 4. She's just still in a diaper at night.
Just
Lincoln was out of a diaper at 2.5 at night.
yeah.
This gal, this bitch, she loves her diaper, right?
Yeah.
And I started thinking, I got to get her out of this diaper. And then I thought, well, what if I don't get her out of the diaper? What if she wears a diaper the rest of her life at night?
Yeah.
And then I just thought, what if I met a super cute girl with an amazing personality when I was in my 20s? Everything was perfect. And then and right before we went to bed, she goes, oh, by the way, I wear diapers when I go to sleep. I'd be like, this is so cute and adorable. I'm
No,
in. You're
I
so
know.
unique and authentic. You're still wearing diapers. It would not be a barrier for me. I would love it. And then we posed that question to all different guys at the party. I was relieved to see that Ryan Hansen said might even like her more. Charlie a little less, but could get through it.
Perfect 10 Charlie said he could manage through, but he
Yes.
wasn't thrilled about the idea.
And Ryan and I were actually excited about the
Yeah.
idea. Because I'm like, this person, they've really thought about the rules of life that they just got put on our shoulders. They've questioned them and they realized, no, this rule's silly that an adult can't wear a diaper at night.
They also
That's a critical thinking
they also don't
person.
have enough control or commitment to bettering themselves, so that they just decided to just wear a diaper their whole life as
See-
opposed to working through an issue.
Listen how
That's a problem.
judgment laden your comment
No.
just was, that they're failing. That they're a failure.
No, I think if you have an issue, you should work through that issue. And I
there-
don't think that's
listen,
judgment. I
there's
think that's
no-
a good thing to want out of a partner. You want that out of all the people in your life.
There's no working through for an old man peeing in the middle of the night. There's no solution. If there
I'm
were,
talking about 20-year-old girl.
okay.
20-year-old girl should have by then tried to figure out, how do I do this? As opposed to just, who cares? I'll just
what's the
not
easiest?
work through it.
Right. Anyways, I wouldn't be off-putting to me. In fact, it might even be
You like it.
appealing. Yeah.
Right.
Okay. Eric Dr. Eric Topol.
Okay, so he mentioned the Turing Prize.
Oh.
And that's the Turing Award, often referred to as the Nobel Prize of Computing. Carries a $1 million prize.
Oh, I want to win it now.
I know.
I didn't care at all until you just said that.
I know. It's named for Alan M. Turing, the British mathematician who articulated the mathematical foundation and limits of computing. He's also that movie, The Imitation Game, with Benedict Cumberbatch.
Oh, okay.
That's what that movie's about. Him.
No,
Yes.
Oh, really? He's the one who decoded the German
Yeah.
messages in World War II.
Yes.
And he was gay, right? He was hiding
Yes.
his homosexuality.
Yeah.
Yeah, it was heartbreaking in that way.
I know. That was a good movie. I
It
liked
really
it.
was.
Yeah.
I would have
him.
said to him, here's what I would have done if I were him, okay?
Okay.
I would have cracked the code and I would have said, I want to call a press conference. And I would say, I have cracked the code. I could save everyone's life, but I want tomorrow morning legislation decriminalizing homosexual behavior. If you want the solution, you're going to have to take it from this gay and you're going to decriminalize gay.
Yeah. I mean, I think there's a lot more emotional hardship to overcome than just
He's already a hero. I'm not second guessing his bravery. I'm just saying, in retrospect, wouldn't it have been great if he held that info hostage until people got their shit together.
People didn't back then. I mean, that'd be hard for someone to do now. Back then, he would have they wouldn't have wanted it. They probably would have killed him.
Also, let's do as a thought experiment something we don't agree with. So let's say that
Okay.
Warren Jeffs, he cures cancer. Says, I got the cure,
Yeah.
but you have to legalize this form of
That's
whatever the hell
yeah.
it is. Yeah.
Torture.
Yeah. Polygamy. What do we do?
Yeah.
I guess this is a utilitarian Kantian debate.
Yeah. I guess you know what? We
Here's what we
probably
do.
don't do it.
I know exactly what we do.
Okay.
We say yes, we legalize it, we get that cure for cancer, and then we go, fuck you, we just double-crossed you, and you deserve to be double-crossed, Warren Jeffs.
Oh, well, I mean, I guess, yeah. but
That's a cool
not-
outcome.
I guess. That's
And it's
also
just like a week of polygamy was legal.
That's not really. That's not really.
We could do it, right?
I
We
don't
could
know that
double-cross
that's a good
Warren Jeffs.
argument, because then you're just not answering the question. Then you're just doing.
No, I'm
Both.
taking the adult who pees in diapers. I'm that third rail no one considered.
I think we don't do it,
Oh.
and you just have to hope that the
And
next
let's say it's
person
your father who's about to die of cancer.
you know. But I guess the hope is that somebody else is close and is
okay.
about to do it.
Okay.
So that who's not going to hold this information hostage.
Fourth option,
Okay.
while he's got the press conference, we send some operatives in to his home and we steal the.
Yeah, I'd be okay with that.
Okay.
Okay. You said you've had a lot of colonoscopies and that you need to get another one.
Mm-hmm.
But according to the world, you really only need to start getting them at age 50.
Yeah. But I have familial
History.
palpopus. I'm saying that wrong.
I know, but remember, you don't have it.
Right. So I went to a proctologist the last time I got one.
Uh-huh.
And he said, and I explained, he said, why have you gotten so many? You've been getting them since you were 18. I said, oh, well, my uncle on my mom's side, had colon cancer, and my cousin had it really young. And he said, that's not what side of the family, familial, whatever, runs in.
Right.
So I stopped getting them. I said that out loud on Jimmy Kimmel, and I got all these tweets going, that's not true. That guy is not telling you the truth.
Oh.
Doctors said it.
Okay.
So may have saved my life to talk about that on Kimmel. But anyways, I need to go in.
But have you ever had one that was a little off or polyp?
No,
or
I've
anything?
all polyp free so far.
So then you probably don't need to, and it's not great to just keep getting them.
Says who?
Says Eric Topol.
Well, I mean, there's no downside other than the expense and the time I wasted of the
Yeah,
proctologist.
right. And
So you're advising me to not get one. Is that what I'm
Yeah.
hearing? Oh, wow.
I am.
That's a really risky position to take.
just for
if
now,
I die in a few years.
you're not going to.
Okay,
See, you're
all
a
right.
7.
Okay.
You're a 7. At age 50, sure.
Okay.
Okay.
Well, that's just around the corner.
Oh, fudge is made?
Milk, lemonade around the corner.
Fudge is made at a colonoscopy.
Yes.
Yeah.
Yeah. Well, you're supposed to, you do the really thorough cleanse the
right.
day before, which is, by the way, the only really bad part of the colonoscopy is the prep.
Yeah.
Because I get knocked out for that. I'm not around for that. I get
Still.
Versed, and then I get propofol or whatever the thing killed Mike Jackson was. And then you're out, and then you wake up and you have a ton of gas, and then you get over that and you're on your way. But the prep the day before, drinking that crazy Fleet enema stuff.
Yeah. Ugh.
Woo!
Yeah, yuck.
No eating.
Right.
Yeah.
The whole day?
Yeah. And I told you, I always get cravings by the end of the day for the weirdest things. So the last time I got it, I got this insatiable craving for McDonald's chicken McNuggets. And so on my way home from the colonoscopy, I got a 20-piece.
20?
Yep. And I ate all 20 of them.
Was this before or after the pink sludge video?
Oh, I never watched that pink sludge video.
Okay.
Yeah, I'm smart
Okay.
enough not to watch
I
things.
watched.
You did?
Oh,
And
yeah.
Have you had a nugget since?
I don't think so.
Oh, really? Has that been debunked or was that actually a legit?
Good question.
Yeah.
I think it was legit,
Okay.
but I don't know for sure. Okay, so I was looking at what do most people go to the doctor for?
Great.
Top 10 things, okay?
Oh, fun.
1, skin disorders.
Oh, sure.
2,
Unsightly rashes?
yeah, like rashes, acne was on there. Like, yeah, probably abscesses on feet.
Sure.
Yeah.
Melanoma.
2, joint pain and osteoarthritis.
Oh.
That's you.
Wow.
Yeah.
Ding, ding, ding.
Ding, ding, ding. 3, back problems. That's me.
Uh-huh. That's great.
4, cholesterol problems.
Oh.
That's you.
Yeah. Yeah.
5, oh, did I even finish the story about my dad? I didn't.
No,
Oh,
you
boy.
didn't.
Oh, boy.
Okay, after I finish this list, I'll do
Okay,
that.
we'll circle back.
5, upper respiratory problems, not including asthma.
Okay.
Okay. 6, anxiety, bipolar, and depression.
Ooh.
7, chronic neurology disorders.
Uh-oh.
Also me.
Sure.
8, high blood pressure. 9, headaches and migraines. 10, diabetes.
Diabetes. Cold is not number one?
I know. That's what I thought.
Is this like a very specific list?
It was a list.
Okay.
It was a
Like
list. And it was
cold
on
and
2 things.
flu, I would just have to imagine is number.
But I don't. Maybe maybe people don't go to the doctor that much for that.
Yeah, who knows?
Because you don't really. Because why? You just have to take cold medicine.
I feel like a lot of people go. Maybe it's an LA thing though. Like
Well,
I'll have
for
a cold.
flu-
People like
for
go.
flu. You should, or you could die.
I mean, sure.
Yeah, people died.
If you have a fever for 6 days or something.
Yeah.
Yeah.
Sorry. So back to my dad.
Yeah.
My
Ashok
dad
Padman.
listened. Good pronunciation. My dad listened to the Sanjay Gupta episode, and I was wrong in the fact check. I told a story about him, and I said that he went to this Ayurvedic doctor, and they gave him this pill. Blah blah blah. Turns out that was a homeopathic doctor, not an Ayurvedic doctor. I
Okay.
thought that was the same thing, but it's not the same thing. Homeopathic medicine is Western.
Okay.
So he corrected me on that.
Great. I'm sure he gave you an earful.
He did.
Yeah.
And he also said the man was 70 years old at the time, and that was 40 years ago.
Okay, so he's 110 now.
Yeah,
Okay, great.
exactly. Okay, so back to facts. Bloomfield Hills, for 2 or 3 years in a row, was the highest earning suburb, according to you.
Yeah.
I couldn't find old information about that,
You couldn't substantiate that?
but it's not even in the top 24 currently.
24 what?
Suburbs. Highest earning suburbs.
Oh.
The top 3 highest earning suburbs
Oh,
in
can
the
I
U.S.
guess?
Sure. You won't guess correctly.
I'm going to say the top 2 are in Connecticut.
No.
Fuck you.
They
Okay.
were on the list.
All right,
There were a
what
lot
is
of
it?
Connecticut ones on the list.
Oh, I guess now we have the whole Silicon Valley thing. Okay, go ahead.
Ross, California is number 1.
There you go.
Ross, California. Medium household income, 250,000 plus.
Dang.
Yes.
Dang it.
Second, Short Hills, New Jersey.
Ooh.
Uh-huh. Also 250 plus. Glenview, Kentucky is number 3.
What?
Yeah.
That is a shock to me, and I'm
Glenview.
delighted.
Yeah.
What's happening in Glenview? I wonder.
I don't know, but 250.
Haynes Underwear Factory.
Maybe
That's
like
in Kentucky.
horse racing.
Oh, right. That's actually a great guess. We one time had a Corvette show down in Bowling Green, Kentucky, and then we had this big event, and we went to some of these, like, where the Kentucky Derby horses are bred.
Yeah.
And this guy who owned this compound, the horse stables were nicer than a Four Seasons. They hosted a dinner in there, and I thought, this is big bucks.
Yeah, big time. And
I love your guess that it's equestrian
Thank you.
related.
thank you. So you said that you were in Nashville and that you drove for 11 miles and there were 12,000-foot houses for 11 miles.
Mm-hmm.
So then I texted Houston Estes, friend of ours, who
Our favorite.
you claimed to be in the car with during this 11-mile drive.
Yeah.
And I asked if this was true. So this is what he said. I asked him a few questions and then he responded, I saw you and Dax on some ridiculous commercial the other day. I immediately canceled my cable subscription. Oh, he's so funny. And then I doubled down on my question. Is it 11 miles of rich houses? Yes. And mine is right in the middle of it. White privilege. And then he said, to be more specific, there are 2 or 3 main secondary roads where the homes are very large, and this continues for mile after mile. It's kind of weird when you see it as not being from here, like Dax.
Okay, he finally got to the real.
Kind of, but he didn't.
Yeah.
He didn't clarify 11 miles, which is what I needed. I needed him to drive the route, but he didn't. He didn't do that for me. Anyway, so that's gonna be it.
That's gonna wrap things up.
Yeah.
Okay. Okay. I love you.
I love you.
All right.
Bye.